How well you know your mental health. Our emotional, psychological, and social well-being all contribute to our mental health. It has an impact on how we think, feel, and act. It also influences how we deal with stress, interact with others, and make decisions. Mental health is essential throughout life, from childhood and adolescence to adulthood. If you have mental health problems, your thinking, mood, and behavior may be affected throughout your life. Many factors contribute to mental health issues, such as genes and brain chemistry are examples of biological factors. Experiences in life, such as trauma or abuse. There is a family history of mental health issues. What are mental health issues? Mental health encompasses more than just the absence of mental disorders. It exists on a complex continuum, with varying degrees of difficulty and distress, and potentially very different social and clinical outcomes from one person to the next. Mental disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm, are examples of mental health conditions. People suffering from mental illnesses are more likely to have lower levels of mental well-being, but this is not always or necessarily the case. Mental health determinants. Multiple individual, social, and structural determinants may interact to protect or undermine our mental health and shift our position on the mental health continuum throughout our lives. Individual psychological and biological factors, such as emotional skills, substance use, and genetics, can increase a person's susceptibility to mental health problems. People are more likely to develop mental health problems when they are exposed to unfavorable social, economic, geopolitical, and environmental circumstances, such as poverty, violence, inequality, and environmental deprivation. Risks can appear at any stage of life, but those that occur during developmentally sensitive periods, particularly early childhood, are especially harmful. Harsh parenting and physical punishment, for example, are known to harm children's health, and bullying is a major risk factor for mental health problems. Similarly, protective factors occur throughout our lives and serve to strengthen resilience. They include, among other things, our individual social and emotional skills and characteristics, as well as positive social interactions, quality education, decent work, safe neighborhoods, and community cohesion. Mental health risks and protective factors can be found on various scales in society. Individuals, families, and communities are put at greater risk as a result of local threats. Global threats, such as economic downturns, disease outbreaks, humanitarian emergencies, and forced displacement, and the escalating climate crisis, increase the risk for entire populations. Each risk and protective factor has only a limited predictive power. Despite being exposed to a risk factor, most people do not develop a mental health condition, and many people with no known risk factor develop a mental health condition. Nonetheless, the interacting determinants of mental health contribute to or detract from mental health. Modifiable risk factors for mental health disorders include socioeconomic conditions, such as whether work is available in the local area, occupation, a person's level of social involvement, education, and housing quality, and gender, etc. Study found that people with low economic status had the worst mental health conditions. Childhood adversity. Several studies have found that adverse childhood experiences, such as child abuse, parental loss, parental separation, and parental illness, have a significant impact on a growing child's mental and physical health. There are also links between childhood abuse and other traumatic events, and a variety of psychotic disorders. These experiences also put people at risk for post-traumatic stress disorder (PTSD). Biological variables. According to the NIMH, genetic family history can increase the likelihood of trusted source of mental health conditions because specific genes and gene variants put a person at risk. Many other factors, however, contribute to the development of these disorders. The presence of a gene linked to a mental health disorder does not guarantee the development of the condition. Similarly, people who do not have related genes or a family history of mental illness can still have mental health problems. Chronic stress and mental health conditions like depression and anxiety can arise from underlying physical health issues like cancer, diabetes, and chronic pain. Different types of mental health disorders. Specific mental disorders are grouped together based on characteristics they share. The following are some examples of mental illnesses: anxiety problems, disorders of the mood, disorders of schizophrenia, and many more. What are some major early signs of recognizing these disorders? There is no physical test or scan that can reliably determine whether a person has developed a mental illness. People should, however, be on the lookout for the following symptoms of a mental health disorder: withdrawing from friends, family, and coworkers, and avoiding activities that they would normally enjoy. Sleeping excessively or insufficiently, eating excessively or insufficiently, feeling hopeless. Having consistently low energy, using mood-altering drugs. Changing substances, such as alcohol and nicotine, displaying negative emotions more frequently. Being perplexed. Being unable to complete daily tasks such as getting to work or cooking a meal, having recurring thoughts or memories of causing physical harm to themselves or others, hearing voices, and experiencing delusions. Diagnosis. A mental health disorder requires a multi-step process to diagnose. To rule out physical conditions or issues that may be causing the symptoms, a doctor may begin by reviewing a person's medical history and performing a thorough physical exam. There are no medical tests that can diagnose mental disorders. However, doctors may order a battery of laboratory tests, including imaging exams and blood work, to rule out any other underlying causes. Treatment. There are numerous approaches to dealing with mental health issues. Treatment is extremely personal, and what works for one person may not work for another. Some strategies or treatments are more effective when used in conjunction with others. A person suffering from a chronic mental disorder may make various decisions throughout their life. The individual must collaborate closely with a doctor who can assist them in identifying their needs and providing appropriate treatment. The following are some treatment options for people suffering from mental illness. Psychotherapy, also known as talking therapies. This type of treatment approaches mental illness from a psychological standpoint. Examples include cognitive behavioral therapy (CBT), exposure therapy, and dialectical behavior therapy. This treatment is provided by psychiatrists, psychologists, psychotherapists, and some primary care physicians. It can assist people in understanding the source of their mental illness and beginning to work on more healthy thought patterns that support daily living while reducing the risk of isolation and self-harm. Medication. Some people take medications such as antidepressants, antipsychotics, and anxiolytics. Although these medications cannot cure mental disorders, they can help a person resume social interaction and a routine while working on their mental health. Self-help. A person dealing with mental health issues may need to alter their lifestyle to promote wellness. Changes such as reducing alcohol consumption, sleeping more, and eating a balanced, nutritious diet are examples of such changes. People may need to take time off work or resolve personal relationship issues that are affecting their mental health. People suffering from anxiety or depression may benefit from relaxation techniques such as deep breathing, meditation, and mindfulness. Having a support network, whether through self-help groups or close friends and family, can also be critical to mental illness recovery.